on that event that President William Ruto is on a 5-day tour of the Western region. Now, the Kenya Union of Clinical Officers, KUCO, has accused the government of high-handedness even as their strike gets underway from today midnight. KUCO Secretary General George Gibore has said the state has gone mute on addressing their concerns, among them alleged discrimination by the Social Health Authority, SHA, and the refusal to impanel facilities owned by clinical officers. Highlighting the plight of the dire situation in the sector, Gibore added that the union has held over 100 strikes since the onset of devolution and none has bore fruit. Now, touch base with our reporter, Chebet Birir, who is at that event right now. Good afternoon to you, Birir, and kindly bring us up to speed on what the KUCO members are saying with regard to the health facilities and healthcare of the nation.
Indeed, clinical officers had notice of January 7 for being locked out for breaching their last year's return to work agreement. And they say that the Ministry of Health and county governments have breached the return to work formula that they signed last year as they called off a strike. They had a strike last year that went for 99 days. Now, the agreement that was breached comprised of a collective bargaining agreement, promotions, comprehensive medical cover, and the confirmation of universal health coverage clinical officers, and those in short-term contractual employment into permanent and pensionable terms. Now, Gibore has said that they will be on strike until further notice, and it began at midnight today. They've decried the discrimination and the exclusion of clinical officers. If you're aware, Dennis, is that clinical officers own health facilities in the country. Now, the Ministry of Health has excluded them from providing service to the Social Health Authority, and this has made clients or other patients to pay out of cash in facilities that are owned by clinical officers. And now they demand an immediate and unconditional recognition and empanelment of providers and practitioners licensed by the Clinical Officers Council. They also want the Social Health Authority Board to immediately reinstate the authorization rights to clinical officers, and this includes full implementation, as well as the full implementation of the return to work agreement. That's it for now. Aseto, back to you in studio.
Now, a section of senators has expressed support for the Controller of Budget's proposal to prevent county governors from allocating county funds for bursaries. Now, according to Kisumu Senator Tom Ojienda, it is important